Hey folks, Nick the Nurse here. Today we're going to be talking about the nursing interventions that should be associated with the patient who has DVT or deep vein thrombosis. So let's get started. You might get a question in nursing school or possibly even on the NCLEX that asks, what should the nurse's next action be, or what should the nurse do? A lot of times questions come up like that. You as a good nursing student, an astute nursing student, should be in a position to tell either the computer or your paper and pen, or pencil I suppose, what it is that the patient or the nurse needs to do. So let's get started with that. One thing that you can do in order to prevent DVT in your patient is to make sure that the patient ambulates early after surgery. Again, empirical evidence-based practice has shown that patients who ambulate postoperatively sooner rather than later develop blood clots or DVTs in lower incidences than those who don't ambulate at all or ambulate after a long period of time. If a clot has formed, you want to make sure that you elevate the extremity, but do not place a pillow under the knees. Very, very important. Again, you can elevate the extremity, but do not place a pillow under the knees. You want to administer heparin to prevent the forming of blood clots if it is ordered by the physician. Administer Coumadin to make sure that you prevent future clots as administered by the physician. You want to monitor labs. PT, PTT, and or INR levels need to be monitored. You want to administer thrombolytics if the physician orders them. Make sure that you're trained or that the nurse is trained to do that. Clot-busting drugs to dissolve the clots that have already been formed. And it must be initiated really within 3 days after the symptoms appear. And you need to do that only if it's ordered. It's not a nursing intervention that can be done without a physician's order. Obviously, it's very dangerous, but it can be life-saving in the right situation. You want to measure the circumference of both lower extremities to monitor for edema, because if you have a real or a suspected DVT in one of the calves, you want to be able to compare both legs, and you want to be able to compare one leg against how it might be in the future or how it was in the past. So make sure that you get that tape measure out and you measure the calves or the body part in question. You want to monitor for signs of pulmonary embolism, because if you have a DVT and the DVT dislodges, it can turn into a pulmonary embolism, which can be what? Deadly. So you want to make sure that you stay away from that. Bad mamma jamma. Okay, you don't want a DVT that dislodges and then gives you a pulmonary embolism. And we'll talk about pulmonary embolism in another video if you'd like to check that out at nickthenurse.com. Also, you want to make sure that you assist the patient in applying anti-embolism stockings to assist in venous return, or having them put on SCDs, the sequential compression devices. Some nursing facilities or hospitals that I've been at call them SCUDs. I can't stand that. They're SCDs, sequential compression devices. What those do is they blow jets of air over the site, or kind of through the things that attach to your legs, and they cause the body to release a hormone. I actually had a physician tell me once, a surgeon told me, that it really doesn't matter if you put the SCDs on the legs or you put them on the arms, the body still produces the chemical or hormone that keeps the DVT prevalence low. So not sure if that's true. That is something that I heard. I don't want to be putting bad information out there, but it was something interesting nonetheless. I just haven't had a chance to research it. So lots of interesting stuff on DVT. Remember some of the big things. We won't go through them all again. Make sure that you ambulate your patient after surgery, apply SCDs or compression stockings as ordered by the physician, and make sure that you're giving anticoagulation or antiplatelet medications as ordered, and monitor those PTs, those PTTs, and those INRs. Extremely important. Again, my name's Nick the Nurse. I want to thank you for watching this video on nursing interventions associated with the patient on a nursing school exam or NCLEX that have to deal with deep vein thrombosis. If you'd like to check out any of my other videos, they're all completely free. You don't have to buy anything, no obligation, no nothing. Check them out at www.nickthenurse.com. Thanks for watching, and we'll see you next time.